Hey everyone, you are watching Animal Freak WSK YouTube channel. If you are a die-hard dog lover and interested in dogs, then make sure to subscribe our channel for daily and unique vlog content. Dog lovers, today we're going to examine a crucial subject: diseases caused by dog bites. Despite the fact that dogs bring us a great deal of happiness and friendship, it is important to be aware of the potential health dangers connected to dog bites. The top 12 dog biting diseases will be covered in this video, along with their symptoms, cures, and most crucially, prevention strategies. Let's get going. Number 1. Rabies. Dogs are susceptible to the viral disease rabies, which affects their neurological systems. It is typically spread through a bite by an infected animal's saliva. Aggression, excessive drooling, paralysis, and ultimately death are symptoms. The prevention of rabies in humans and dogs depends heavily on vaccination. The virus attacks the brain and causes a range of symptoms, including fever, headache, anxiety, and confusion, progressing to aggression, hallucinations, and paralysis. Rabies is almost always fatal once symptoms appear, making prevention crucial. Vaccination of domestic animals, such as dogs and cats, along with responsible pet ownership and avoiding contact with wild animals, are vital in controlling the spread of rabies. Immediate medical attention and post-exposure prophylaxis are essential if exposed to a potentially rabid animal. Number 2. Infection with Capnocytophaga. Dogs frequently have this bacteria in their mouths. Even while it rarely makes healthy people unwell, it can induce life-threatening infections, especially in people with weakened immune systems. Fever, headaches, blisters, and muscle soreness are possible symptoms. Capnocytophaga infections require immediate medical attention as well as antibiotics. Number 3. Pasteurella. A type of bacteria known as pasteurella is frequently seen in dogs' oral cavities. It can result in infections of the skin and soft tissues when spread through a bite. Swelling, redness, discomfort, and pus-filled wounds are some of the symptoms. In order to avoid further difficulties, it's imperative to clean the wound and get medical attention. The disease can be treated with antibiotics, but prompt diagnosis is crucial to avoid more severe outcomes. Prevention measures include avoiding sandfly bites by using insect repellents and wearing protective clothing. Number 4. Tetanus. The microorganisms Clostridium tetani are responsible for the bacterial infection tetanus. Although uncommon in dogs, it can spread through significant bite wounds. Tetanus can be fatal and results in muscle rigidity, spasms, and difficulties swallowing. Treatment for this infection requires prompt medical attention, wound care, and tetanus vaccination. Number 5. Bartonellosis. Bartonellosis, sometimes referred to as cat scratch illness, can be passed on to dogs through cat bites. It is brought on by the Bartonella bacteria and can result in fever, exhaustion, swollen lymph nodes, and in extreme cases, problems with the heart or nerve system. Bartonellosis is normally treated with antibiotics. Number 6. MRSA. MRSA is a strain of Staphylococcus aureus that is antibiotic resistant. Dogs can have MRSA in their jaws, and a bite from one of them can spread the bacterium and infect a wound. Redness, swelling, and uncomfortable abscesses are symptoms. The recommended course of treatment includes MRSA-fighting medications and adequate wound care. Without exhibiting any symptoms, dogs can carry MRSA on their skin or in their nasal passages. Direct contact or touching contaminated surfaces can result in transmission. When handling dogs, especially if they have wounds or skin illnesses, it's critical to practice good hygiene. MRSA transmission between dogs and people can be minimized with proper hand washing and surface cleaning. Number 7. Leptospirosis. Leptospirosis is a bacterial ailment that can affect dogs when they come into touch with contaminated water or animal urine. Although less frequent, transmission by bites is still a possibility. Fever, vomiting, muscle discomfort, and in serious cases, kidney or liver damage are some of the symptoms. Leptospirosis can be prevented in large part via vaccination. The bacteria can enter the dog's body through mucous membranes or open wounds. Leptospirosis can lead to flu-like symptoms, organ damage, and in severe cases, it can be fatal. Vaccination and preventative measures, such as avoiding stagnant water sources and maintaining good hygiene, can help reduce the risk of leptospirosis in dogs and prevent transmission to humans. Consulting a veterinarian is crucial for diagnosis, treatment, and prevention strategies. Number 8. Tetany. Tetany is a condition caused by low calcium levels in the blood. A dog bite to certain areas of the body can result in trauma to the parathyroid glands, leading to tetany. Symptoms include muscle spasms, tremors, and seizures. Veterinary care is essential to stabilize calcium levels and provide appropriate treatment. Tetany is primarily treated by addressing the underlying cause, which is frequently a calcium or magnesium deficit. Intravenous calcium or magnesium infusion is used to quickly elevate their blood levels and treat symptoms in acute situations. Long-term management includes making dietary modifications or taking supplements to make up for any nutritional deficiencies, such as a lack of vitamin D or magnesium. In some circumstances, underlying hormonal abnormalities or the regulation of calcium levels may be treated with medicine. To improve general health and lower the likelihood of tetany episodes, lifestyle changes like stress management strategies, sufficient sleep, and regular exercise may also be advised. A healthcare professional's advice is essential for accurate diagnosis and customized treatment planning. Number 9. Ehrlichiosis. Ehrlichiosis is a tick-borne disease that can affect dogs and humans. It is transmitted through the bite of infected ticks. Symptoms may include fever, lethargy, loss of appetite, and joint pain. Early diagnosis and treatment with antibiotics are crucial for managing this disease. Humans are primarily exposed to these germs through the bite of infected ticks, such as the black-legged tick or the Lone Star tick. Fever, headache, exhaustion, muscle aches, and in extreme cases, issues affecting the nervous or respiratory systems can all be signs of ehrlichiosis. Antibiotic therapy and early diagnosis are essential to avert catastrophic consequences. The key to prevention is avoiding tick bites by wearing protective clothing and applying insect repellents. Number 10. Streptococcal infection. Infections produced by the Streptococcus genus of bacteria are known as streptococcal infections. Although less frequent, dog bites can bring these germs into the body and cause a number of illnesses, from minor infections like strep throat to severe ones like cellulitis or necrotizing fasciitis. Streptococcal infections can range in severity. Pain, redness, swelling, fever, and in severe cases, tissue damage may all be symptoms. Streptococcal infections are normally treated with antibiotics. Number 11. Staphylococcal infections. Staphylococcal infections are caused by bacteria from the Staphylococcus genus. Dogs can carry these bacteria in their mouths, and a bite can introduce them into the body, resulting in infection. Staphylococcal infections can lead to skin and soft tissue infections, such as abscesses or cellulitis. Symptoms include redness, swelling, pain, and the formation of pus. Proper wound care, antibiotics, and in some cases, drainage of the abscess are necessary for treatment. Number 12. Tetanus. Tetanus, also known as lockjaw, is a bacterial infection caused by the Clostridium tetani bacteria. Although rare in dogs, it can be transmitted through deep bite wounds. Tetanus causes muscle stiffness, spasms, difficulty swallowing, and can be life-threatening. Immediate medical attention, wound cleaning, and a tetanus vaccine are crucial in treating this infection. Precaution is crucial. It's crucial to keep in mind that the majority of dog bites do not result in illness, despite how terrifying the discussion of these dog-biting diseases may sound. But taking preventative action can greatly lower the likelihood of transmission. Here are some crucial pointers. Give your dog regular vaccinations, including the rabies shot. Make sure your dog receives routine veterinary care and adopt a proper pet-owning attitude. To reduce aggressive behaviors, socialize and train your dog. Do not approach strange dogs, especially those showing signs of fear or hostility. Teach kids how to behave around dogs and monitor interactions. If a dog bites you, wash the wound with soap and water right away, and, if necessary, get medical help. Inform your local authorities about any stray or vicious pets. Conclusion: it is critical for the health of both our pets and ourselves to understand the various disorders linked to dog bites. We may ensure a secure and pleasurable relationship with our cherished dogs by being aware of these top 12 dog-biting diseases, their symptoms, treatments, and prevention methods. To keep our pets healthy and safe, keep in mind that responsible pet ownership and education are essential. Stay safe, and may you and your animal friends share a lifetime of delight.